Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones, and as always I want to welcome our guest Fran London. Hi Fran.
Hi Chuck.
For those of you that may not know, Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book, and I'll hold it up here, No Time to Teach: The Essence of Patient and Family Education for Healthcare Providers. I wanted to read it this time because I didn't do it right last time. We use Fran's book, No Time to Teach, as the source of a lot of our topics each week on the Patient Educators Update. But here recently, we have been responding to questions that we get from chief nursing officers, directors of nursing, patient educators, and just nurses in general. And Fran, the question I got the other day on the website was, how can I make sure every nurse is educating patients the same? And I think that there are two questions here as I interpret her question. Not two questions, but two ways to approach this. Number one is making sure that nurses teach the same information in terms of evidence-based, so it's factually correct. And then the other part of the question is making sure the nurses teach the same way, meaning a process that they follow where they do their best to understand where the patient's at, what they know, what they don't know, how they like to learn, kind of where their mindset is on learning and their condition, and then from that determine what to teach and how to teach it, and then along the way double check to make sure the patient is learning. So let me have you weigh in on that. Do you think my assessment is right on what she's looking for?
I would agree with that. It seems to me that both are equally important, that you have to have a good method that's efficient and effective, and then you also have to have content that the whole team teaches consistently.
Yeah, okay, well now let's address the content first, the evidence-based stuff, because you talk about this a lot. How can the patient educator or the chief nursing officer make sure that all the nurses are teaching the same evidence-based information?
There are a couple of ways to work towards that goal. One is to make sure that everyone knows what the appropriate treatments and the description of the diagnosis is based on what we know right now. So that involves both making sure that the staff has in-services and knows what's going on and agrees with the policies, which are up to date and current, and that the patient education teaching materials you have, the videos, the handouts, all have the correct up-to-date content so that everybody's teaching the same thing. The awful thing would be if the patient gets conflicting information from different healthcare providers on the team and then doesn't know what to do and then thinks we don't know what we're doing. That's what you want to avoid.
Yeah, and of course, if that happens, you want to make sure that the lines of communication are open enough with the patient so they will say something.
Exactly.
And there's an opportunity to correct it,
exactly,
so to speak. Yeah.
Yeah, you want to feel comfortable.
Yeah, okay. Now, I know you typically can only address this in your own environment, but how difficult is it to make sure that the hundreds of nurses that work in your hospital are all on the same page?
It's about communication. So it really is how the team works together in general, because you're always having the team members talking about a patient, certainly a change of shift, certainly when you're talking about new medications that come out, new equipment that comes out. So all of those are opportunities to talk about what is current and appropriate right now. Yeah. So there are lots of ways to add it in.
Mm-hmm. What about refresher information where there have been updates where, things that were taught in nursing school 10 years ago and they're different today? How is it best to address that?
And services are really good because then you get people talking to each other and you get to figure out what people believe based on what they learned, and information changes so quickly in healthcare that you really do have to keep up to date.
Yeah, that would strike me as one of the most difficult jobs, is because there's so many things that change so quickly, and so many sources that might say, things differently. So,
Yes.
so that's where the hospital policy comes in, where the policy's got to be adopted, that this is what the evidence shows, this is what we're going to do. Okay.
Yeah.
All right. So, so having the up-to-date information obviously is important. Now, let's talk about the process and how the nurses should do their communication with the patients. I don't see a whole lot of discussion about processes out there, but you and I have talked. There definitely needs to be one. Not so much that the patient understands there's a process, but that the nurse has a roadmap or a navigation system where he or she basically does the same things over and over. It becomes a habit in terms of how they do it. And because it's a navigational process, they're able to do the same process with each patient, but they do it differently based on where the patient's at, how they feel about where they are, what they need to know, and how they want to learn. So everything is personalized, which is something you talk about in your book.
Yeah, I think you said it pretty clearly. Basically, it's the same 3 steps: assessment, teaching, and then evaluation of understanding. And the assessment is the part where you listen and you find out where the patient is, so that when you present the content, you're presenting it in a way that's relevant and that they can understand. And then the evaluation of understanding is just to get them to teach it back to you or show you, so that you can identify whether or not they've got it and got it all and got it correctly, and if you have to correct any misunderstandings.
Yeah, yeah. Now, there's a second phase to your education process, which has to do with helping the patient apply this to their normal life, because everybody's situation is different, from education to socioeconomic, and you talk about it in the book as coaching. So talk about that a little bit.
Well, the 2 steps to patient education are the information sharing and making sure they get the information right, and then the application of that information to life, which is actually much more complex, and probably that part of the teaching needs to continue throughout the continuum of care. So it's not something you learn, if you're diagnosed with diabetes and you get a new diet, it's not going to be something you learn in the hospital in half an hour and then suddenly your life has changed and you're eating differently.
Right.
It's a process. You need to be coached through that to make the behavior changes over time, and then there'll be resistance to some of it, there'll be misunderstandings about some of it, and you have to work with that in a negotiation over time.
Yeah, and negotiate is probably a good way to approach that because of the resistance. And the other thing that's there is the nurses in the hospital don't always have the follow-up with the patient after discharge. That falls to someone else. And if there's not a consistency of communication beyond there, and if we use a change in diet to address diabetes or something like that, just as an example, if there's not some follow-up to help them understand how changes in their shopping habits in the grocery store, their food preparation habits, their eating out habits, if that's not coached over time, guess what? They're going to go back to the old way pretty quick.
Exactly. So we have to recognize that behavior change is the key to improving health outcomes and is probably a time-consuming, long-term investment.
Yeah, and I don't want to put words in your mouth, but is that where one of the biggest failures is in education right now, that it's dropped off after the fact?
I think that's a problem primarily because of reimbursement. There's payment from third-party payers for prescriptions, medications, surgeries, but not for those long-term conversations in general, to keep the behavior changes going.
Yeah, and there's no doubt that that's expensive because of the labor associated with doing all the follow-up.
But we have to look at the expense of not doing it.
True. Yeah. What's the old saying? If you think training and education is expensive, look at the price of ignorance.
Yeah, exactly.
Yeah. Yeah. Okay. So interesting topic today. Just as a reminder, the question was, how can I make sure every nurse is educating patients the same? And of course, the answer is you don't want them educating patients the same. You want them to use the same information, but you want it to be tailored based upon the way the patient views the world, understands where they are, and what they can do about it in terms of their application to their own personal situation. Does
Exactly.
that about sum it up? Okay.
Yep, you got it.
Okay, all right. Good topic. So with that, why don't you tell folks where they can find you online?
I have a blog at www.notimetoteach.com, and I'm on Twitter at NoTimeToTeach.
Okay, cool. And I also see you on Facebook and Google Plus and Pinterest and other places periodically. But those are your two most popular, the blog and Twitter. And I might say you're active on Twitter as well as the blog. So if any of the nurses out there have questions that you will answer, I know you do. So all they need to do is just either tweet or put a post out there, and you will respond to them, because I like to do the same thing.
Yeah.
And so we'd love to have the conversation going, and we'd love to continue this process of answering questions on the show, because it brings it to the real world, takes it out of all the good stuff that's in the book. It helps us apply it to the real world. And for those folks that are interested in adding video and video on demand into their patient education process for their hospital, please visit our website, synergybroadcast.com, and look under Solutions for Healthcare and Patient Education. You'll see our product, MMDS, or Medical Media Delivery System, and it's a video on demand delivery system that we have available. And we have also got all new kinds of content that we didn't have a year ago. So there's all new kinds of things that we've added to the system. So please take a look. So Fran, thank you so much for your time and attention this week, and I look forward to talking to you again next time.
Okay. Bye, Chuck.
Bye-bye.